Good afternoon and welcome to Webinar Wednesday. Today we are joined by Dustin Smith, Senior Advisory Solution Consultant at Nuvolo, and Arlene Tucrawl, VISN2 Healthcare Technology Manager at VA. Webinar Wednesday would like to thank our sponsor Nuvolo. The Nuvolo Connected Workplace for Healthcare Solution is the only modern CMMS built on ServiceNow designed to meet the unique regulatory, clinical, operational, and cybersecurity needs of the healthcare industry. For more information, please visit nuvolo.com. Here at TechNation, we want to keep you up to date on all the latest news from the TechNation community. So in the handout section of your webinar dashboard, you'll find a few PDFs, including the pre-show planner for MD Expo Houston, which takes place next week, the 11th to the 13th, the pre-show planner for our HTM Mixer in Baltimore in May from the 11th to the 12th, information on the call for presenters for our October MD Expo in Orlando from 29th to the 31st of October, details on our HTM Week contest, and applications for the 2023 class of 40 under 40. So when you have a chance, have a look at those handouts. Okay, today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. April is National Frog Month. What is the name of the famous green frog who is the star of the Muppets? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on your webinar dashboard. As I mentioned earlier, our presenters today are Dustin Smith and Arlene Tucrawl, and they will be discussing Maximize Your CMMS to meet regulatory requirements. Arlene, you may begin whenever you're ready.
Okay, great, wonderful. My name's Arlene Tucrawl. I'm the VISN2 Healthcare Technology Manager with over 10 years of experience in HTM.
And I'm Dustin Smith, an executive solution consultant. I've been with Nuvolo a little over 3 years now. Prior to this, I spent just shy of 14 years with Intermountain Healthcare, and look forward to the conversation today. Thanks, Arlene.
So today we'll start with going over our CMMS journey in VISN2. As you can see from this map, our region is composed of New York and New Jersey VA medical centers. We'll also cover various workflows and advantages of service level agreements. So why did we start our journey towards a new CMMS? We wanted to expand our functionalities. It was important for us to be able to have standardized documentation, including PM checklists, reconfiguring the way that we documented with problem causes resolution codes, including resolution detail questions in accordance with the AAMI CMMS guidance for problem cause resolution codes. And we also wanted to take advantage of due dates so that we could create service level agreement compliance. We also were intrigued by the work project, contract module, and AEM modules provided by Nuvolo CMMS. ServiceNow, which is what Nuvolo sits on top of, allows you to build approval workflows, and this was something that we implemented in our deferred PM workflows. We wanted to have traceability of our OIT tickets that are related to HTM work orders. And again, this was possible because our OIT counterparts already utilize the SNOW platform. We did have some Joint Commission findings on documentation of PM, and we recognized that our service contracts could have improved procedures. So the extra modules that a CMMS would provide were attractive to us. We also recognized that our legacy system had limited visibility for customers. We wanted to increase communication on our work order between our customers, provide live feedback to our customers regarding the status of work orders, as well as build in transactional survey responses. So we started our journey over a year ago and implemented Nivolo in our VISN 2 sites over the summer last year. The impact to our VISN and facilities was immediate. We were able to have improved Joint Commission traceability of deferred PMs. We also created a work order type for medical device safety incidents and implemented checklists to allow us to trend on those checklist details. We were able to have trend evaluation of live and historical data. Nivolo has full audit capabilities. We did find benefit in that. And then as far as recurring tasks, we were able to reduce some effort by prioritizing based on due dates, having automatic generation of our follow-up PMs and quality assurance work orders. We also improved upon our incoming inspection process by adding a verification step, which I will talk more about shortly. This is what our service portal looks like. Our customers can access this from our VA apps folder. It's not permission controlled, so anybody can submit a work order in our organization. You can note that there are different request types. Submit a work order is a typical corrective maintenance request. We also have a button for medical device safety incidents. This is to capture any near misses that impact the patient or employee. And then we also have various requests for turn-in, deinstallation, professional service requests such as new equipment support, and a button there for all other support types. We did see post our Q3 implementation, a jump in the users across our VISN. So our customers did readily adopt the new portal process. One key feature of our portal is that we educated our users from the clinician side to set up home wards. The idea is that if you're a clinician that floats between areas, say a nurse from floating from the ICU to med-surg, you're able to update your home ward to see the relevant information for your ward for the day. By going into the ward reports, our clinicians are able to see open work orders and closed work orders. The data is searchable by clicking into the request number. They can also use the Control F feature to search for specific EE numbers or make models. Another report available is the devices. This can be useful for looking at the end of life date, which is beneficial for equipment planning. This is an example of improved documentation and communication with our customers. So you can see here our customer relayed that there's a delay in patient care. This sent a notification to the technician assigned in an email. And this work order had better communication as a result. This is another example of internal HTM communication. This technician was able to email buyer support for instructions on how to link an order and manually create a patient manual study. This is advantageous if you have staff out for unexpected leave to ensure that the work can continue to progress. Here's an example of our transactional survey that is issued upon completion of the work. You can see here we're able to track through a live report the number of responses and the average score completed by quarter. We were able to increase the trigger rate when we wanted to improve the number of responses that we were attaining, and definitely very good for us to be able to ascertain the type of service that we're providing to our customers. A hospital EC that is important for regulatory compliance is EC 020401, where the hospital manages medical equipment risks. If the medical device has a near miss, it's important that we treat that a little bit differently and complete a investigation. So in that, with that in mind, we were able to create this separate request type and collect information from our customers regarding the impacted asset and whether or not there's been patient harm or employee harm. So our workflow is to automatically assign these work orders as high priority. So once the staff are alerted, they arrive on scene and complete their incident investigation using a go back and checklist. They sequester the medical device and accessories, attain device logs, ensure to capture pictures and attach that to the work order as well. Another nice thing is that we've built in quality assurance work orders. So for this work order type, 100% of the work orders generate quality assurance work orders for the managers to review and confirm that the work order does not need alteration in its documentation before it can be moved forward to close complete. This is some of the questions on our equipment-related incident checklist. So I've highlighted some key information that is relevant to the investigation, such as the event details, how the device was involved, the types of tests that were performed, and also the last service date, whether the device is on the proper PM schedule, whether the device is on an alternative equipment maintenance, as well as what are the recommended actions to reduce the incident from reoccurring. Another key feature of our regulatory compliance is ensuring that we're following manufacturer's guidance for preventative maintenance. Nuvolo has a functionality called maintenance definitions, which allows for automatic generation of PM work orders based on certain filter criteria. So some examples of those filter criteria can be location, the model, the inventory number, as well as age. So this was something, some additional functionality that we worked to build in to be able to do some survival analysis. But essentially, you could set age as a criteria for how you set your preventative maintenance frequency. While it's wonderful to be able to set these kinds of business rules to ensure that you're not having to re-implement the preventative maintenance requirements for each new device that is being brought into your organization, I do want to caution that there is also risk involved with maintenance definitions, and it absolutely requires oversight and proper implementation. So just to go over, what the maintenance definition looks like, you can see here there's asset condition. This is defined as a particular facility with the model of MACME 360, and for devices that are in use or out of service with an annual frequency and a start date of April. So this business rule maintenance definition is going to automatically create instances which will then generate the PM work orders with the appropriate lead time, so 30 days prior to April, because this is an annual frequency. So to go further into why you have to be cautious is, if you are changing a start date, you need to be cognizant of whether or not a expired sticker would have the preventative maintenance frequency lapse. So you may have to, in your transition to a new CMMS, create reports to show devices where a PM has not been created to ensure that you're catching such cases. And then one thing that we're doing to seek new development for is seeing if our system can utilize the last maintenance date, which in our organization we have defined as only preventative maintenance work orders that are closed with certain resolution codes, such that if the last maintenance date is past the frequency requirement, the system can auto create a follow-up PM. So we do hope that this new development will mitigate the risk involved with CMMS transitions. In addition, we have conducted a lot of work with our PM work group to identify what the OEM frequencies should be for certain models. So we've set up those rules and created reports to track where there's deviances from those rules. In addition, there may be cases where service manuals do not state a specific frequency and state periodic, in which case we have reviewed the work order data and the medical device incident history to reach consensus amongst our group and come up with a standard for our group. In order to understand the automatic workflows that we built around PM closures, I'll talk a little bit about the PM work order problem cause resolution codes that we set up in Vision 2. So we have pass and complete pending HTM corrective, indicating that we have completed the preventative maintenance, but maybe we have found some issue that requires an additional part that would then generate a corrective maintenance work order to address there. Complete pending other service correction would be where perhaps you're completed the MRI PM, but there's a shielding problem. So the other service, being engineering, would have to be involved to get that corrected. Deferred out of service is a common resolution code, so I'll skip that. Deferred in use is when the device is being used on a patient. Deferred could not locate is when you've attempted to look for the device, but it cannot be found. Deferred pending turn-in is where the customer is communicating to you that they do not intend to utilize the device and it has been stickered as out of service and is pending turn-in by the organization. Deferred inaccessible is where the equipment is involved in a medical device incident or some flooding or act of God incident where it is not available for preventative maintenance. And then pass with corrective is where we were able to correct something with the device during the preventative maintenance. You can note that the follow-up PM has the same resolution code options. So to go through the automation, you can see that when the PM is closed as pending HTM corrective, a CM work order is automatically generated. Similarly, for could not locate, there is actually a approval workflow sent to the EIL manager, and the follow-up PM is auto-generated. This is a case where we still have to get the work completed, and the device could potentially be in use out on the floor. So it's very important that we are mitigating that risk by having an open follow-up PM for it. For deferred in use, this does not count against the PM completion rate, but again, it is work that still has yet to be completed and is tracked through a follow-up PM that is auto-generated. And deferred pending turn-in, we've built automation there where a follow-up PM will auto-generate after 2 months if the device is not in turned-in status. So I'll talk a little bit more about the approval workflows. For deferred in use, we created a approval request to the on behalf of user. This is something that the technician fills in as a clinician that they have corresponded to determine the availability of the device. So that clinician will receive the approval request and be able to indicate when the device will be available in the comments of their approval to allow for better coordination of performing the PM. Similarly, for a could not locate, you can see here that the customer will receive a approval request where they can approve if the manager agrees that the device cannot be found and certify that the device report a survey is to be initiated, and they can reject if the device was found and indicate in the comments the updated location. This is showing a use case where an oxygen concentrator was found due to the automated email that is received by the EIL manager helping us perform the PM. You can see here that the follow-up PM was closed as pass as a result of that improved culture of safety. Similarly, we also had instances of customers rejecting the approval, indicating that the device can be found in the location that it was scanned. We have also built an approval workflow for turn-in requests where the EIL manager receives an approval request. They document their approval to turn in the device, and then through the work order, our staff are able to ensure that the PHI and networking information is sanitized. Next, I'll talk about device onboarding. So EC 020401EP requires that the hospital inspects, tests, and maintains medical equipment. Because our interface is across 2 different systems, logistics enters the inventory in Ames MERS, and then it has to flow across to Nuvolo. We actually were able to create a step to have the manager verify that the device has the appropriate information entered before the incoming work order is generated. So the information that the manager is verifying includes its naming, its asset value, EIL manager life expectancy, and they also fill in the HTM support groups so that the work orders can auto-assign in the future and ensure that the device is covered by a maintenance definition for the required preventative maintenance. So we are ensuring that 100% of our incoming inspection work orders are generated, because this is an automation in the software after the verification of the device. One caveat here is that there should be some sort of report to track the unverified devices to make sure that they are being addressed timely, as you know will not be able to kind of track it through just work orders alone, how many devices are sitting in that unverified state. And we've also created a generation of QA work orders for our incomings, and 2% of those are generated. Another mandatory field on the resolution tab for our work orders is whether the dose output change has occurred. This is important so that we can ensure that a physicist inspection is completed within 30 days for the qualified devices. I'll talk a little bit more about the quality assurance program. So as you can see here, we are able to set an audit percentage in order to give the system input onto what percent of your work orders should generate as per an audit quality assurance work order. And so each problem cause is dependent on the type of work order being closed, and then the resolution code can be pass or fail. So the workflow here is that a QA work order is generated and it's automatically assigned to the appropriate supervisor. Then the QA work order is generated as the child work order of the original work order. So different QA checklists are used for various types of work orders, and the supervisor will ensure that the proper procedures are being followed and the work order is properly documented. If they need to move the original work order back into a pending documentation state to address the documentation, they can do so. As you can see here, the work order type is quality assurance, and this is for a medical device investigation. Here's an example of the quality assurance checklist for preventative maintenance. We have the manager review whether the sticker on the device has been updated, whether it is visible, looking at whether or not there is an equipment inventory label as well. And then next I'll talk about service level agreements. So Nuvolo does allow for service level agreements to be set so that there are notifications set to both the technicians or the customer on any breaches that occur to these SLAs. Here's some SLAs that I've risen to put into place. We'll note that time on hold is set based on substates of awaiting parts or awaiting vendor. Having SLAs in place does allow you to collect valuable information. One example is looking at how many times equipment was put on hold. And you can also evaluate the durations of the work orders put on hold. This might help inform business decisions regarding what vendors to send repairs to versus order parts from. So this is a sterilizer dashboard that was developed by our Risen 2 reporting work group. It was a customer-facing dashboard, and our customers like the fact that they can review the on-hold awaiting vendor service result of the data. So this is not only informative for HTM in making their business decisions, but our customers are also enjoying the information. Now I will pass it on to Dustin.
Thanks, Arlene. So when we think about everything that Arlene has talked about so far, Vision 2 has truly gone through and they're leveraging Nuvolo through their deployment to ensure their success from a compliance perspective. All of this level of work can lend itself to certain materials that we could leverage not only in an audit performed internally, but also when Joint Commission shows up and during periodic reviews. This is a great example of a fairly simple environment of care report that really covers a good portion of the EPs that even Arlene has covered prior to seeing Nuvolo in this context. Other ways where we can assist you in your compliance journey, one of the things Arlene briefly brought up was AEMs. So we've taken the Joint Commission framework and we apply it in the sense that we leverage an asset hierarchy within Nuvolo that goes from an asset type down to a model and subsequently a device. So we have a setup that enables us to maintain your AEM eligibility at that asset type level, and then further at your model level to ensure that you're not putting in imaging systems and medical lasers. So just one of the ways that we have taken into consideration the accreditation needs that are out there and the compliance needs that are out there to enable your success. Once you understand any of your devices that are included in an AEM, you can, if desired, create an AEM plan within the context of Nuvolo, and you can leverage certain metrics to help you determine whether or not the maintenance of those new devices under a non-OEM plan is negatively or positively impacting your mean time between failure, your maintenance cost, labor hours, and is there a new risk score suggestion? Also, when you think about the AEM guidance that has come from the Joint Commission, a good portion of it was modification of risk score over time. So now, in the past, unfortunately, the probability of a failure was oftentimes lacking. And so kind of the new age risk scoring methodology that's being almost universally adopted is probability and severity to determine a risk score level that is both quantifiable so we can start ultimately tiering our devices and managing their service accordingly. Also worth noting is there are a couple of EPs that we do a tremendous amount of assisting with that Arlene didn't cover, but we can still assist with. Everybody out there, I believe, is familiar with all of the issues that have come out regarding our Alaris pumps, okay? A good portion of devices have Alaris pumps in their environment, and God bless you if you do, because there's unfortunately been some headaches over the last few years. Well, one thing that's worth noting is a good portion of recalls that have come out within the past probably 4 to 5 years, they're starting to incorporate software version. And so it's important when we're thinking about EC.02.01.01 EP11, which is the management of recalls, that we set up our recalls in a way that we're capturing the devices that do need work performed against them, but we're not focusing on those that are in a software version that's not impacted. Okay, so when we think about creating a recall within the context of Nuvolo, I can start getting to a deeper level of granularity than I believe we've really tried to leverage in the past. So to showcase this example, we're going to go ahead and look at, are there any models that contain Alaris? Okay. And once I've done this, I'm going to go ahead and refresh. That's 73 records. But this is a particular software version level. And so I can further fine tune and start looking at a specific rev level. And now I only have 12 devices. So when we think about recall management, why is this important? Well, we just went from 73 to 12. That's a pretty decent chunk of change when we think about the time it's going to take for your technicians to go cruise around chasing down pumps, which could literally be anywhere. So that's one element of it. A question that frequently gets brought up, though, is whether or not we could leverage an integration with Rasmus or ECRI. The answer is yes, but are we going to get that rev level from Rasmus and ECRI, and do you have that maintained in the system? The reason I bring this up is because one thing to note, as I apply these to my devices, it didn't automatically kick out the work orders. And that's a good thing, especially when we think about the context of our Alaris pumps, because we may want to understand, if we think about the bezel assembly recall that came out, there were times when BD was offering to help us out. And so before we generate these work orders, which I'm going to do now, we want to have a plan and be able to articulate that plan of action with our technicians because we don't want to scare them. Okay, so something very important to realize, and one of the ways that we can really help organizations, again, ensure that they're fulfilling the needs of EP11. Another thing that Arlene had talked about was the ability to work with your authorized service providers to get work done. So within this, on my device, I have an understanding of contracts that are associated with the device. And I'm going to have corresponding contract levels that when a work order kicks out, I can readily see that a device is under contract. On my asset record, I can have described my primary service provider so that I can start taking the steps necessary to schedule that work to that specific service provider. And if desired, I can even incorporate the specific technician name while putting in our reference number. So we're giving you the tools for whether it be technicians or you have some sort of service coordinators that can come back in, attach those FSRs, and document the costs associated with that coverage so that it can slate into and start defining the value that you receive from your contracts. But the more important aspect of this that I'd like to showcase is Arlene had talked about SLAs. You can also leverage those to start tracking the performance of your vendors against what's defined within their contract. If they say that they're going to have a certain level of response within 2 hours, then if you have somebody who can diligently work with those technicians from the authorized service providers, as long as they switch the state of the work order, you can better track the performance to the contractual obligations that you've made with ultimately your partners. So it's not about sticking it to your OEMs or the authorized service providers. It's about having an understanding of how we're performing and how we could better work together. Because even with the right to repair being so foundational to our industry right now, we need the OEMs and they need us too. So let's find better ways that we can work together. And the last thing I really want to hit on is Arlene had talked about physicist checks. And one of the things that's important to realize is you could have the physicist directly log into a system like Nuvolo and start performing their physicist check directly in a work order form that would kick out a corrective. And then you're going to have that timestamp and that understanding of exactly when I need to turn that around. And even within any of these questions, you can see here, I have a range bound question that is literally related to the MQSA tied to a mammo device. So this is directly based off of the, I'm trying to recall exactly what CFR, but this is the standard. So if you give your in-house physicist teams, or even if you're leveraging outside organizations access to your system, then you can have that true definition of exactly where a device landed, and that can mitigate the need for paper binders. And unfortunately, I don't know how many other people are dealing with it, but I dealt with paper binders for a very, very large part of my career. And specifically, Mammo was one of the departments that really struggled to kind of get away from it. That and labs. But so these are a variety of different ways where above and beyond even what Arlene talked about regarding some of the workflows that they had set up, ensuring that the appropriate approvals are there and that cross communication between healthcare technology management and clinicians was fine-tuned. There's also a wealth of things directly out of the box that can benefit your adherence to the compliance standards of not just Joint Commission, but you have ACR, CLIA, CAP. I mean, the list goes on. At the end of the day, HTM is probably one of somewhere between 10 and 20 acronyms that we deal with on a fairly regular basis, and that's just part of the gig. So I really hope that what Arlene and I have talked about today and what has been showcased gives you a better understanding of how your CMMS or potentially a new CMMS can really help you start improving your ability to manage audits and ensure your compliance with whatever accreditation standards that you ultimately need. And with that, we will go ahead and open it up to questions.
Great, that's perfect. Thanks, Dustin. We've got a few questions coming here. Can Nuvolo leverage meter-based PMs?
Yep, absolutely. I know some ventilators, they call out specific hours where you're going to have to do a certain check. And so we could leverage that as a figure that you're inputting either through a checklist or what we call asset metrics on the device. And then it would kick out the corresponding either PM or meter-based corrective maintenance that's needed.
Okay, so is an EMR integration necessary to track Sentinel events?
Definitely not. And Arlene, I kind of want to lean on you for this one because you've done a ton with near misses and patient incidents. I don't believe you have an EMR integration. I guess what are your thoughts on this?
Yes, so we don't have an EMR integration. We're asking our customers to submit to the HTM service portal, but the risk management division of each facility would still be responsible for reporting to the FDA as necessary.
Awesome.
Great, and another question here is, how can Nuvolo differentiate maintenance-related failures from human errors?
Yeah, so great question. So within the problem codes, when you're setting up your problem codes, you can actually, there's a little checkbox that says fault related. And so you can leverage the fault related checkbox to basically determine, is this PM based? Is it a maintenance related failure, or is it human related if that checkbox were not filled? And that's going to help you track mean time between maintenance related failures.
Okay, another question here is aimed at Arlene. Did you define the HTM to customer communication with clinical input? And did you define the requirement before or after you selected Nuvolo?
We did engage our customers in order to make sure that we were incorporating the correct naming for the wards, so it made sense to them intuitively when they were setting their wards. We also incorporated their feedback when designing dashboards, so we typically piloted it with one facility before making it available across each of our facilities. But the communication aspects that I screenshotted are actually out of the box, so there wasn't much customization required to, have the comment box. With regards to the approval workflows, that's something that we're still iteratively improving. We did have a request for further information. So for example, for the turn-in workflow, the reason for turn-in is a development story to capture that information. So yeah, definitely it is good to, with any change management, incorporate frontline feedback if that's possible.
Okay, and one here for Dustin. Can you talk about the importance of HTM departments defining their workflows and requirements before selecting and implementing or upgrading their CMMS?
Yeah, great question. So one of the biggest benefits you're going to get with any CMMS transition is it's an opportunity to blow up what doesn't work and kind of start anew. And when you're doing that, there's always I hope it's a desire, but I would definitely say it's a need to kind of standardize what you believe to be best practice within your organization. And then as you go through that journey with a new tool, because that's really what a CMMS is, I I would say it's beneficial to go into that kind of philosophy with open eyes and be willing to fine tune both sides of the equation, right? Because one piece of it is your internal business process that you've now defined to be ultimately best practice, and you've spread that amongst your entire system, ideally. And the other is what comes out of the box with the tool you're evaluating. I think you can definitely shape both of those, but it should be shaping. It should not be completely rebuilding. And I think that's the easiest way to facilitate success. I do want to ask Arlene, though, is there anything you would add to kind of that response, because you've recently gone through this?
Yes, I think that having a clear vision and requirements definitions is super important. Um, Getting familiarity with the agile development process is also key. Um, there will be miscommunications in how the acceptance criteria is written and how the developers develop the code. And, there's going to be opportunities during testing to identify defects. But it's like a whole team working together that requires, everyone to understand that vision. Um, in order to continue that development. So I think that be prepared to have the FTE necessary to devote towards the configuration and development. Be prepared to invest time towards communication and training um, so that the implementation can be successful.
That's great. Okay, we've got one more question here that's come in. How many checklists can Nuvolo pull up, or do you use different checklists?
Yeah, so typically we have what we call pre and working checklists. So for a specific work order, you would typically see it in two different spots. So one is going to be when your work order is in a draft state, and the other is when you're in a work in progress state. For all intents and purposes, I haven't heard of any limitations in regards to number of checklists that you could store. It's having the right amount of questions that your technicians are going to want to actually answer and answer in a productive fashion against a work order, right? Because that's where it does get a little complicated, because we want everything to be simple for a technician, but we also want the appropriate level of verification details. Like the MQSA example that I had showcased, that physicist check, I want to say it's about 18 questions. And really, if you're going over 30 questions, I think the depending on what you're trying to get recorded in the system, because all of those responses are recorded as verification details that are housed within a work order, you could end up in a position where people aren't paying attention as much. So to concisely answer the question, there's really not any limitation to the number of checklists you could have in the system, but typically against a specific work order, you would only have two ultimately pop up.
That's great. Thank you so much, Dustin. We haven't got any more questions, so we can wrap up there. Thank you, Dustin and Arlene, for your time today and for a great and informative presentation. I'd like to encourage everyone to visit Nuvolo's website today to learn more about the products they provide to the industry. So please visit nuvolo.com. As promised, the answer to today's trivia question is, of course, Kermit. So congratulations to our winner, Tony Dodge. Just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once a survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you again for your time today, and happy Easter from everyone here at TechNation.
Thanks, everyone.